Does your work involve the corporate real estate or the facilities management practice? Are you currently losing sleep addressing COVID-19 within the workplace? In this two-part video series, we'll first show you how to utilize Archibus to adapt to the new reality by using environmental health and safety features. To effectively manage the emergency workforce, there's a few measures as part of a day one approach. We'll need to promptly respond to incidents and impacts caused by COVID-19 by managing through exceptions using metrics and alerts regarding the number of incidents related to COVID-19, and of that, how many are new cases recorded within the office, or is related to social distancing not being practiced. Also, to have reminders to ensure that staff receive personal protective equipment, training, and follow-ups to monitor COVID-19 related symptoms. For part 2 of this series, we'll be addressing a few more situations to manage within the emergency workforce, so be sure to watch for that video as well. For now, let's be reactive to some scenarios that are happening very quickly within the workplace. Further, we'll show you where there are opportunities to be more proactive as well. The first thing we're going to demonstrate is having to report an incident. What if a staff member has informed you that he or she is feeling too sick to access the online tool and report that they are feeling symptomatic? With role-based Archibus, a user with the manager or supervisor level access can also register incidents in the intake form. This here is an enhanced form compared to the simplified version for the typical end users. And as we continue adding data, you'll be able to see the level of detail available to the manager's level. We can create different types of incidents to track. We have a special package that allows you to get started with a COVID-19 library, which you can further build upon after as well. We'll be prefacing that we need to register a staff member that is eligible to take a COVID-19 assessment, and as the testing criteria changes, eventually we'll be able to track more employees who fit this criteria. This staff member may also need some time off as a result of any symptoms. For now, we'll capture the essence of the situation by filling out the description. We can opt to fill in what we know for now, and we can always come back to add more details as information becomes available. Note that instead of an employee, I can also link the incident to a company contact or a non-employee. Notice that I do have other incident types that I can record, such as a COVID-19 support, where staff may need time off to support a family member, as well as a social distancing option in the event that staff are not practicing the requirements within the workplace. With that, we'll have built our incident repository of all intakes coming from the end users as well as the managers. Now let's take a look at an existing registered incident. It looks like we have a staff member who's displaying symptoms and may even lose a few days at work. We find out that this employee has been remote for some time. In this situation, we don't believe they put the office space at risk. With the emergency contact list report, this allows me to look up a staff member and the options to get in touch. Staff can help keep this information up to date so that in the event that the individual is ill and unresponsive, we would need to be able to reach the emergency contact. After hearing from the contact, we find out that the employee has taken a turn for the worst. It'll be important to track if employees have been hospitalized and where they are currently located. So let's fill in the attending hospital's details. In the event of a serious consequence, we have a place to store that detail as well. Next, we'll need to understand how we can make corrective actions against this incident. To better move forward, we want to understand how did it happen. We can track it under a root cause category, be it due to the community transmission, work travel, or rather being a close contact. In addition, we can track the amount of lost work days due to this individual being symptomatic. In the short term, the corrective action would be to quarantine. We'll come back and revisit this last section. First, I'll need to set some reminders for medical monitoring. At around the 7th day, we'd want to do a follow-up with our employee to see how they are doing and if they still feel symptomatic. And once we register this, by the 14th day, we also want another follow-up on the symptoms. The system automatically generates the second follow-up. We'll be also able to set up notifications and alert reminders to perform this monitoring task as well. Once these tasks are marked as completed, I can come back to the incident response section and make that update that the staff has recovered. However, we may also have to investigate if the staff can resume normal duties. In the meanwhile, I should investigate what kind of training program we have set up for the staff member in the past. I find out that the staff member performs a lot of setup and takedown for workstations and meeting rooms. Within the medical monitoring section, I see that there's been monitoring done to confirm the staff is capable of carrying heavy items across multiple locations. Let's check if they have any personal protective equipment for their work. They've been granted gloves and steel-toed boots. That would mean that we've never provided masks for that kind of work. As a proactive measure moving forward, we may have to revise our current business practice and give additional personal protective equipment to all members doing similar work. We're also aware that this individual could potentially be working alone at times as part of a training requirement. So again, reinforcing that our current practices may not meet the safety requirements caused by COVID-19, this gives us a chance to review and improve the training programs. We come back to the incident tracking form. This section allows us to track any temporary or permanent restrictions in place, such as registering that the staff has to temporarily work from home, or track the days lost due to falling ill. While we hope our staff member makes a speedy recovery, there's always a chance that something life-changing occurs. The staff could have permanent damage, for example in the lungs, that are scarred due to the treatments from using a ventilator. Let's track a scenario where the staff has permanent difficulty in breathing. In that case, we may have to even consider providing job transfers because the staff can no longer carry items of heavy weight across multiple locations without running out of breath. In this particular example, there may not be applicable training, but if you do have a training program to help the staff member, you can assign them to a one-off to refresher courses. In addition, personal protective equipment can be provided to further help the employee in the situation. Any documentation available to support the situation can also be uploaded to the system. Let's take a look at another situation. Here's an incident where someone has reported that staff members are not practicing social distancing at an office location that is still open. In this situation, there may not be any medical events to record, so instead let's focus on the location details. We'll be able to mark up the drawing and identify locations that were affected. Instead, we'll also look at the corrective actions. We can identify root reasons why such an occurrence happened. In this example, we'll preface that it may have alluded to how the interior spaces were arranged, which traditionally promoted co-working or the gathering of people. Further, we can create short-term to long-term actions to handle the situation. A short-term action would be to close that space and disinfect. Here we can prompt for a cleaning ticket of the space. Note that it's carried over all the details already from our incident. A time and date can also be identified. In this case, it could be a task that needs to be completed by the end of day. Meanwhile, a long-term action can also be created. In this case, it could be to redesign the arrangement of the space. And again, we'll create a service request so that it could be performed to meet the requirements of social distancing. These requests follow the workflow of service-level agreements within Archibus's on-demand or service request application so that the proper team handling the work can complete and update the ticket statuses. As per the workplace restrictions, we can track that this individual will need to self-isolate for a recommended period of time. Since the individual has not reported feeling ill, we won't be adding any lost days to the count. As per related training response, staff can also receive corrective training. These training programs can be a one-off or an ongoing series. For example, a social distancing training class has been assigned. Should there be any personal protective equipment that can further help the employees, whether it's a one-time supply or an ongoing supply, these can be made deliverable. Last but not least, let's recall that there's likely more than one individual involved. We can link this incident by using the copy incident function, which carries over the details, and we can now associate additional affected individuals. With this repository of incidents, let's take a look at how the reporting shows the power of the data. Here's a report tracking what personal protective equipment needs to be delivered. Items in red indicate that they are overdue for delivery. Items in yellow represent that it's getting close to the delivery date. You can set rules to define the number of days you would consider overdue. Similar reports are available to address training deadlines and medical monitoring deadlines. These reports, combined with the metrics that report through the alerts and with the option of notifications, further ensure that all critical dates are not being missed. Let's run some key reports for decision support. This incident log, like many of the Archibus reports, features ad hoc filtering, allowing us to slice and dice our search criteria and prepare user-defined reports. In this case, I'll be searching for anything having to do with COVID-19. It allows me to summarize key outcomes such as how many productive days were lost as a result of staff members who were sick, and if there were any deaths within the organization that occurred as a result of the pandemic. Also, how many employees have to have a work restriction in place. The button here also quickly allows me to generate exportable OSHA reports and logs that are pre-formatted to standard and ready for use. For statistical themed reports, here's a dynamic chart allowing us to create user-defined filtering criteria as well as select our different grouping options so that we can summarize by locations or with a breakdown of the different incident types. Again, prefacing the exporting options, you can export the chart as you see it. The map report is an excellent choice for organizations, be it one with a global portfolio or an organization whose portfolio spans across many sites, or rather has many facilities within a site, allowing us to graphically report on hotspots for COVID-19. With that, that concludes part 1 of the video series for managers in the workplace, where we shared how to track and manage incidents and highlight key reports. In part 2, we'll show you some more expansive features that are part of the Emergency Workforce Package, so be sure to watch that video. Thank you for watching, and we'll be seeing you again soon.